we studied about how the Echinococcus granulosus eggs get ingested into the human through the contaminated food and water, and after digesting this it gets into the duodenum, where these eggs get hatched and there evolves out the hexacanth embryo that has a hooklets, and that penetrates the intestine, and from the portal system through the or via the portal vein it enters the liver, and there it forms the structure, the cyst. That hydatid cyst contains the larval stage of the worm, and then we seen that how the cyst is formed, and there are 3 layers. The innermost layer is the endocyst, formed by the larval stage of the hookworm, that is Echinococcus granulosus, and then it secretes inside the fluid, that is Hydadid fluid, and the sand, Hydadid sand, and outside it forms a layer known as ectocyst, and the outermost layer is formed by the liver. It is in reaction to the Echinococcus granulosus. The outermost layer is the fibrous layer and it is thick layer. So in exams this question comes as a long question, and you have to describe, you have to draw the diagram of this hydatid cyst with all the brood capsules and scoliosis inside it with the stalk, and you have to describe how the daughter cysts are formed, how granddaughter cysts are formed. Now, I don't know of what was the reason that lecture got interrupted in between because of the net reason or net issues. So I will continue with the treatment. Before describing the treatment of a hydatid cyst, I would like to share, and it is very important, it could be asked in your practical exams also, that what is hydatid thrill? Hydatid thrill. So it is a confirmatory sign to get confirmed about this disease. It is known as hydatid thrill. In this you have to put 3 fingers, or you have to apply 3 fingers over the region of liver in the right hypochondric region, and then percuss by the middle finger, and you will get the impulse by these 2 fingers. So after percussing with the middle finger, the impulse is felt by the other 2 fingers. That impulse is created by the fluid. So that's why this is called hydatid thrill. It could be asked, it is very important. Then in treatment, if the cysts are less than 5 centimeter, so if cysts are less than 5 centimeter, and if they have got calcified, if the cysts are less than 5 centimeter and if they have got calcified, or if they have got bad and the fluid has got absorbed, if the cyst get dies and the fluid get absorbed, or cyst gets calcified, or if the cysts are less than 5 centimeter, then we will go for the conservative treatment. Means we will leave the condition and we will not interfere. Think for the medical treatment. Go for the medical treatment if cysts are disseminated. Disseminated cyst. So if cysts are disseminated, if they are multiple, difficult to operate, multiple and deep-seated. So if they are multiple and deep-seated and difficult to operate, Then, and if there is contamination of peritoneal cavity during the process of surgery or during the operation, so we will go for the medical treatment. In medical treatment, we will give medicine albendazole. Albendazole, we will keep the patient on albendazole for 6 months. So it's a big time. And then we will wait for the subsiding of the clinical features. Generally, the patient is asymptomatic. He or she could not be aware of this hydatid cyst inside the liver. But sometimes the dragging pain and the hepatomegaly and other features can indicate the patient. Then surgical treatment. We will go for the surgery if the cysts are more than 5 cm and if cysts are infected. In these two conditions, we will go for the surgery. Now in surgery, we will do what? We will first try to isolate the cyst from the peritoneal cavity. So we will isolate from peritoneal cavity. By keeping the packs inside, the packs are dipped in hypochlorite solution. So packs of hypochlorite solution. So we will keep the packs of hypochlorite solution between the hydatid cyst and the peritoneal cavity to avoid the further spread of infection into the peritoneal cavity. Besides this, we will do laparotomy. Then we will do what? As we have seen the pathology, how the cyst is formed, it has 3 layers. The outer layer is the fibrous tissue layer that is formed by the liver in response to this parasite, and this thick layer is adherent to the liver surface. So if we will remove it, or if we will touch it, or if we will try to peel it off, then it will result in bleeding because it is adherent to the liver structure. So just try to avoid to remove this advential layer, but sometimes to excise the cyst completely, to stop the spread of infection further, we have to remove the advential layer. This procedure is known as cystopericystectomy. Cystopericystectomy, when whole cyst is removed along with the advential layer, that is the pericyst formed by the liver, the outer layer. So removal of the whole cyst. Excision of the cyst can be done, and the other way is that inside the cyst and then peel the laminar layer with sponge holding forceps. So inside the cyst, the contents will come out, or the fluid that will aspirate that fluid, and then peel off the laminar layer. We have seen the laminar layer is formed by the endocyst. It is an ectocyst which is very elastic and white in color like the shell of egg, but not hard like the shell of egg, white and elastic in look. So it will get peeled off. So just inside the cyst and peel the laminar layer, that white and elastic layer, that is the ectocyst of the hydatid cyst. Just peel this layer with the help of sponge holding forceps. So here I am showing you. It can be asked in exams, in practical. This is the sponge holding forceps.